Listen, here's what nobody tells you about emergencies. It's not the hurricane, the blackout, or the collapse that kills most people. It's the third day. It's when your child's fever hits 104 at 2 in the morning and the pharmacy is dark. It's when that small cut on your wife's hand starts weeping yellow pus and the red streaks begin crawling up her forearm like poison rivers seeking her heart. It's when your father's lips turn to cracked paper and his eyes sink back into his skull from dehydration while you stand helplessly in your kitchen with nothing that actually works, watching him disappear before your eyes. That bright, clean CVS with the bored pharmacist behind the counter, that's not infrastructure. That's a mirage. It works perfectly right up until the exact second it doesn't, and when that moment comes, you will discover that everything you thought was a quick trip away was never really there at all. The human body is a fragile machine that's gotten very good at pretending to be robust. We've outsourced our survival to supply chains we don't understand, run by people we've never met, operating on assumptions never tested against real collapse. Your local pharmacy stocks about 3 days' worth of most medications. The warehouse behind it, maybe a week. The manufacturing plants in India and China that produce half of America's pharmaceuticals are 6,000 miles away, connected to your bathroom cabinet by the thinnest possible thread of just-in-time logistics that has zero redundancy built in. When that thread snaps, and history shows it always does, you have about 72 hours before treatable problems become fatal ones. We live in a bubble of medical abundance that has no historical precedent. For the vast majority of human existence, an infected splinter could kill you. Diarrhea lasting more than a few days was often a death sentence. A fever that climbed too high meant brain damage or death. We've become so divorced from biological reality that we've forgotten how easy it is to die from things that seem trivial. The antibiotics that can reverse sepsis, the IV fluids that can correct dehydration, the emergency rooms that never close. All of this represents a brief golden age that is far more fragile than anyone wants to admit. So let's talk about the 8 unglamorous over-the-counter items sitting on pharmacy shelves right now that could decide whether your family rides out the next crisis or becomes a statistic. Not the sexy prepper toys that get all the attention, not the tactical gear or the firearms or the freeze-dried meals, the ones that address how human bodies actually die when modern medicine disappears. Number 1, and this is non-negotiable, oral rehydration salts. Diarrhea and dehydration kill more people in disasters than bullets, trauma, and infection combined. After the 2010 Haiti earthquake, cholera and dehydration killed more survivors than the collapsed buildings that made international headlines. In every refugee crisis, every natural disaster, every breakdown of sanitation systems, the same pattern emerges. People empty out and dry up and die from something that costs pennies to prevent. Your body is 60% water, but it's the precise balance of sodium, potassium, and glucose dissolved in that water that keeps you alive. When you lose fluids through vomiting, diarrhea, or sweating because the air conditioning died with the grid, you're not just losing water, you're hemorrhaging electrolytes. And here's the thing nobody understands. Drinking plain water doesn't fix that. In fact, if you're severely dehydrated, chugging water can trigger hyponatremia. Your cells swell, your brain swells, and you get worse instead of better. Oral rehydration solution is stupidly simple. 1 liter of clean water, 6 teaspoons of sugar, half a teaspoon of salt. That specific ratio creates a co-transport mechanism in your intestines that pulls water into your bloodstream 25 times more efficiently than water alone. The World Health Organization calls this one of the most important medical advances of the 20th century, and you can make it in your kitchen for pennies. But here's the catch. When your 6-year-old has been vomiting for 14 hours and is lying limp on the couch with dry eyes and dry lips, you will not be doing careful math. You'll be panicking, your hands will be shaking, and precision will be the last thing on your mind. That's why you buy the packets now. Pedialyte powder, drip drop, bulk electrolyte mix. Precision matters when panic is in the room, and pre-measured packets are the difference between guessing and knowing you got it right. Next, diphenhydramine, Benadryl. Most people think allergy medicine when they hear this name. That's like calling a Leatherman a bottle opener. It completely misses 90% of its value. This medication crosses the blood-brain barrier and does 3 things that become genuinely life-saving when hospitals aren't an option. First, it can slow the early stages of anaphylaxis, buying you 20 crucial minutes when someone's throat starts to closing or they begin wheezing after a wasp sting. It's not a substitute for an EpiPen in full-blown anaphylactic shock, but it's the difference between having time to figure things out and watching someone suffocate in front of you. Second, it's a powerful sedative when someone is losing their mind from pain, terror, or slipping into shock. When you have no trauma training and no morphine, sometimes forcing someone unconscious is the most merciful thing you can do. Sleep is the body's repair mode, and sometimes you need to force that switch. And third, and this is the part people don't talk about, diphenhydramine has anticholinergic properties that kill nausea and motion sickness. Picture evacuating in a truck bed over destroyed roads with a concussed family member vomiting every 10 minutes. That vomiting isn't just miserable, it's dangerous. It's dehydration, it's aspiration risk, it's making a brain injury worse. 2 Benadryl can shut that down completely. This single medication might be the most versatile pill in your house during a real collapse. Third, loperamide, Imodium, the antidiarrheal that everyone jokes about until they actually need it. In a crisis, your gut will betray you. The food safety standards you take for granted are going to evaporate. Bad food, cans stored in heat, questionable water, stress that physically damages your digestive system, something will trigger the violent 8 times a day kind of diarrhea that empties a person out and leaves them gray-faced and shaking on the floor. Loperamide works by slowing gut motility, giving your intestines time to reabsorb fluids instead of flushing everything straight through. And here's the tactical reality nobody talks about. If you're on the move, if you're trying to stay hidden, if you need to remain functional, uncontrollable diarrhea isn't just a dignity issue, it's a security problem, a hygiene catastrophe, and a fast track to complete collapse. 1 dose gives you 12 hours of control, and sometimes 12 hours is the difference between making it to safety and collapsing on the side of the road. Pair it with oral rehydration salts and you've neutralized the 2-headed monster that's destroyed more disaster survivors than anything else in human history. But stopping fluid loss is half the battle, because once pain and fever take hold, everything starts breaking down systemically. Pain and fever control require both ibuprofen and acetaminophen, because they work through completely different mechanisms. Acetaminophen handles fever and certain types of pain by affecting the central nervous system. Ibuprofen tackles inflammation, swelling, infected wounds, sprains, muscle damage by blocking inflammatory pathways. More importantly, you can alternate them every 3 hours for continuous coverage without overdosing on either. A fever above 103 degrees for too long starts denaturing proteins in your brain. Children can seize from hyperthermia. Adults become delirious and non-functional. Pain destroys sleep, spikes stress hormones like cortisol, and collapses group morale. Managing both pain and fever is how you keep people functional when everything else is trying to break them down. And once you stabilize the inside, you have to protect the outside, because every break in the skin is now a door you can't afford to leave open. Triple antibiotic ointment: bacitracin, neomycin, polymyxin. This combination represents decades of research into which antibiotics work best topically without causing resistance issues.
Skin is your primary defense against a world absolutely crawling with bacteria that would love nothing more than to colonize the warm, wet interior of your body. The moment you have a cut, a popped blister, a burn, a torn fingernail, you've opened the door. Let me walk you through exactly what happens without this. Someone in your group slices their hand prying open a jammed door during evacuation. It's not deep, just a clean laceration that looks minor. You wash it with bottled water. Wrap it with a clean bandage. Move on. 2 days later, they mention it's sore. You unwrap it to look. The edges are pink and puffy. Day 3, there's pus, yellow-green discharge with that distinctive sweet, rotten smell of bacterial colonization. Day 4, red streaks are running up their arm and they're running a fever. Day 5, they're delirious from sepsis. Day 6, they're dead. That's the actual timeline without antibiotics. And that's how people died for thousands of years from injuries that we'd consider trivial. Antibiotic ointment breaks that chain. You clean the wound with soap and water if you have it, pat dry, apply the ointment, cover with a clean dressing. The ointment keeps the wound moist, which speeds healing, and the antibiotics create a chemical barrier that kills bacteria at the site before they can establish a foothold. This cheap tube is literally the difference between wounds that heal and wounds that kill. Povidone iodine, Betadine. This is the brown liquid that hospitals use to sterilize skin before surgery, and it belongs in your emergency kit because it's one of the few antiseptics that's both devastatingly effective and safe for use on open wounds. Alcohol burns like hell and actually damages healthy tissue. Hydrogen peroxide foams dramatically and looks like it's working, but it kills healthy cells right alongside bacteria and actually slows healing. Povidone iodine kills bacteria, viruses, fungi, and even some protozoa with minimal collateral damage to your own cells. You can use it to disinfect intact skin before closing a wound. You can dilute it to irrigate deep cuts or puncture wounds. In a genuine emergency, you can even use it to purify drinking water. 5 drops per liter, wait 30 minutes, and you've killed most waterborne pathogens. That versatility is what stops the cut on your kid's knee from becoming the infection that keeps you awake at 3 in the morning, watching red lines crawl toward their lymph nodes like poison seeking their heart. The brown staining is actually useful. You can see exactly where you've applied it, see the coverage, see when it's worn off and needs reapplication. In a crisis, that visual feedback matters more than you'd think. Now here's what nobody expects to become a problem until it drives them halfway to madness. Hydrocortisone cream, 1%. This seems trivial until you understand what actually happens when you're living the scenario. Picture this, you're 10 days in, wearing the same clothes, no real ability to shower, stress destroying you from the inside out. Your partner develops a rash across their ribs, probably from sweat, dirty fabric, who knows what. It starts itching. Then it's all they can think about. They scratch it during the day. They scratch it in their sleep. They scratch until they bleed. And now you've got raw, weeping skin and fresh infection routes in someone who was perfectly healthy a week ago. Or your kid gets mosquito bites that turn into quarter-sized welts that they claw at unconsciously in their sleep, turning minor insect bites into open wounds. Hydrocortisone is a mild topical steroid that calms the screaming inflammation and breaks the itch-scratch cycle that can destroy skin integrity. It won't cure a fungal infection or kill bacteria, but it stops people from tearing their own skin open in response to itching that becomes genuinely maddening. In a long-term survival scenario, intact skin is armor against infection. This is how you maintain that armor when stress and poor hygiene try to destroy it. And finally, the one that seems completely trivial until it quietly destroys someone's ability to function. Acid reducers, omeprazole or famotidine, not just calcium carbonate antacids. Stress ulcerates. The human digestive system is exquisitely sensitive to cortisol and adrenaline, and when you're running on fear, garbage food, and no sleep for days on end, your stomach starts digesting itself. Picture someone in your group who's been holding it together, staying strong, being the reliable one, but they haven't slept in 4 days because every time they lie down, they're choking on burning acid that climbs up their throat. They can taste it, that sour, caustic burn at 3 in the morning while everyone else is trying to rest. The nausea, the inability to keep food down, and you're already rationing calories they can't afford to lose. Their morale is gone. They're becoming a liability instead of an asset. Omeprazole and famotidine don't just coat your stomach like Tums do. They reduce acid production at a cellular level, giving the stomach lining a chance to heal instead of just masking symptoms. When you haven't slept in days because of the burning, these pills are mercy. They're the ability to stay functional when your own biology is working against you. And functional is survival. These aren't glamorous tools, but they hit the exact failure points that turn manageable problems into body bags. The exact failures that hit on the 3rd day when the adrenaline wears off and biology takes over. Here's what ties all 8 together. They address the most common, most statistically probable ways human bodies fail under crisis conditions. Not gunshot wounds that get all the attention in movies, not radiation poisoning that make dramatic television. Dehydration, infection, pain, fever, allergic reactions, digestive collapse, and skin breakdown. These are the silent killers that fill mass graves throughout history. And availability is fragile more than anyone admits. Pharmacies operate on razor-thin inventory because storage costs money and medications expire. When demand spikes, first week of COVID, 48 hours before a hurricane, any hint of supply disruption, shelves empty in hours.
The people who walk in on day 3 of a crisis find bare shelves and apologetic staff. The people who quietly bought extra bottles over the course of normal months, who spent maybe $60 total assembling this kit, they're the ones who don't have to choose between watching infection spread and praying to gods they don't believe in. You don't need a medical degree to use any of these. You need to read the dosing instructions, respect the contraindications, and understand that these buy time, not miracles. They bridge gaps between problems and solutions. They turn 3-day crises into survivable problems while you wait for services to restore or figure out next moves or let immune systems do their actual work. They're not replacements for emergency rooms and surgical intervention. They're what you use when those things aren't coming.